السلام عليكم ورحمة الله وبركاته. صباح الخير. My name Fathiya Al-Awadi. I'm a consultant endocrinologist and head of endocrine department at Dubai Hospital, Dubai Health Authority in United Arab Emirates. And I'm the president of Emirates Diabetes Endocrine Society. It gives me great pleasure to welcome you all to this morning forum. And as we are approaching the holy month of Ramadan, I would like to wish you all Ramadan Kareem, inshallah. Allah يعود علينا وعليكم إن شاء الله بالخير والبركة. This morning for 1.5 hours, we will be having an interactive forum, which is Ramadan between science and religion. And we have 3 experts in their field who will be introduced shortly. And before I just introduce them, I just want to remind the audience, we have a good number of people who connected with us this morning. And please, this is an open forum, so we want to make it as much as we can interactive. So if you have any questions, please feel free to write in the chat box, and we will be more than happy to address all the questions. So I will start with the introduction of our first speaker, Dr. Muhammad Al-Qubaisi, Dr. Sheikh Muhammad Al-Qubaisi. He is a PhD holder from Baghdad University in 2002. He memorized the Holy Quran by heart at the age of 12 in Makkah al-Mukarramah. And he holds many scholarly degrees in different Islamic and linguistic science. And he's an author of many books and articles in both in Arabic and English. He's currently the Grand Mufti in Islamic Affairs and Charitable Activities Department in Dubai. And he is also part-time professor at Islamic Culture, Sharjah University. And he is a writer and presenter of Understanding Islam on Dubai 1 TV. He had received many awards and honorary recognition, and I'll just mention some of them. The Dubai Excellence Awards winner as Innovative Employee, and he was honored by His Highness Sheikh Mohammed bin Rashid Al Maktoum in 2009, and he achieved also the first place in Excellent Program of Islamic Affairs and Charitable Activities Department in Dubai as Distinguished Mufti for the year 2009, 2011, and 2015. Welcome, Dr. Qubaisi, to this forum.
Assalamu warahmatullahi wabarakatuh. Shukran jazeelan. Jazakumullah khair. Thank you very much for the introduction.
And our second speaker is Dr. Maysa Hamad. Dr. Maysa is a consultant physician in clinical nutrition and obesity medicine. She's specialized in diabetes care and total quality management for the healthcare reform. Dr. Maysa had obtained her MBBS degree from Alexandria University in 1995, and she had obtained her diploma of public health and clinical nutrition from Alexandria University in 1999, and a total quality management diploma in 2018. She also had obtained her master degree in diabetes care from University of Salford, Manchester, UK, in 2020. Dr. Maysa, I'm glad to know that she was raised and brought up here in UAE before she moved to pursue her career in Alexandria. She had published several articles in her field and received several awards. One of them was Outstanding Dissertation Award from Salford University in 2020. Dr. Maysa, welcome to today's forum.
Thank you very much, and I'm so glad to join you all today.
Our third speaker, who's known to most of you, I'm sure, Dr. Mohammed Hassanin, a friend and a colleague. He's a senior consultant endocrinologist at Dubai Hospital, Dubai Health Authority. He's adjunct professor of medicine at Mohammed bin Rashid University and Gulf Medical University in UAE, as well as at Cardiff University School of Medicine in UK. He's the chair of Diabetes and Ramadan International Alliance. He's also an examiner at the Royal College of Physicians PACES exam, and he is the first author and co-author for almost 80 papers in various topics, particularly diabetes and Ramadan. Also, he had co-author recommendation on the same subject for the IDF in 2016, ADA 2005 and 2010, and BMJ in 2010, and he presented at numerous occasions locally and also regionally and internationally. He also developed 3 educational programs for diabetes Ramadan in collaboration with various international centers. And he's a co-recipient of Diabetes UK Structure Education First Prize in 2008 and 2009, as well as EST Educational Prize in 2009. Dr. Hassanin had developed various national and international guidelines, and he is also an associated editor of Diabetes Research Clinical Practice Journal, as well as Dubai Diabetes and Endocrine Journal. Dr. Hassanin, welcome.
Thank you very much, Dr. Fathiya. It's a great pleasure to be with you as a moderator. You are yourself one of the experts in the field and a joint partner in many of these projects. So thank you for moderating this important webinar.
Thank you for all our three speakers, and without further delay, we will just start our forum. So as you are all aware, the vast Muslim fast, and they are very passionate about their fasting. And indeed, you know, most of them, they will fast safely without any problem during the holy month. However, we are still concerned about those who may face some difficulty to fast safely during the holy month of Ramadan. So my question will be addressed first to Dr. Mohammed Hassanin. Let us know about the risk of fasting that some can face.
Thank you very much. Yes, this is a very important question, the risks of fasting. First, let me reinforce what you said, that the vast majority fast without problems. Nevertheless, modern medicine is about picking those at risk, those at high risk of getting any medical problem. So it's important for us to understand this point. Ramadan fasting, because of the nature of the balance between the treatment and the blood glucose levels, consequently, many people could be exposed to low blood glucose levels. I'm trying to avoid too many medical terms because I hope that many people, even non-medics, could be attending this. Also, unfortunately, after the long fast, many people overindulge. So they could end up with high blood glucose level, which sometimes could be too high, that leads to hospital admission. For some, maybe those who are working in hot weather, not living in countries of hot weather, but actually physically working or exposed to the heat for many hours, they also, when they are fasting, could be exposed to dehydration. We had one report in the past about possible thrombosis, but we haven't seen this frequently. So yes, it's mentioned, but the true big issues are the hypoglycemia, which is the low blood glucose level, the high blood glucose levels, or dehydration in some people. But again, the vast majority are able to fast, and our job is to try to pick those who are at a serious risk.
Thank you very much, Mohammed, for this. But what do you think is, you know, these are general risks. So how we can best identify the risk of each individual, as some have problem related to diabetes or their work or social circumstances make their fasting difficult. So how can we quantify for these aspects together?
This is a very important point, is how can we individualize the risk? Because in the past, we used to have big lists of those who are at very high or low. But life is so complex. For example, we used to say, for example, that people with type 1 diabetes must not fast. They are very high risk. But we know from practice, and perhaps from the exposure to better insulins and modern technology, that many are able. So the question is, which person with the condition is not able to fast? So we have to look into not just the type of diabetes, but the type of treatment. Do they feel it when their blood glucose levels goes low? Do they have frequent episodes of going low? Have they had recent bad emergencies? Is their blood glucose level controlled or not? Do they check or not? You just need to imagine yourself in a car, whether it's your driver or a taxi or Uber or a bus, and the driver have diabetes on insulin, not checking. Obviously, if they check frequently enough, they will be able to feel or to see my blood glucose level is getting low. People with kidney problems, people with heart problems, people whose job is not maybe like me in a comfortable air-conditioned office, maybe doing a physically exhaustive activity, or just give it other social aspects. I live on my own, and I'm on treatment that perhaps would make my blood glucose go low, and my recognition for going low is not so good. So having someone with me all the time will be a support. I traveled now to UK or to Canada, and it's long hours of fasting, different with what I'm used to. So we as clinicians need to think of all of these points add them together, and then make a risk quantification rather than a rigid aspect of you have type 1, you are on insulin, you are with a kidney problem. How severe is the kidney problem? You have a heart condition. I have many friends with a previous heart condition who play sports every day. So then fasting Ramadan for them might be easy. Yes, they have diabetes. Perhaps it's diabetes recently diagnosed compared to someone with very long history. So my age, my duration of diabetes, my social circumstances, my environment, my medication, all of these points. And that's why, alhamdulillah, we have developed the new risk calculator. So you can, or the healthcare professional, even the patient himself, can put all of the points and they accumulate and add together. And then if it comes to be high, it's high. If it comes to be green, it's low. If it comes to be in the middle, then you can make up your mind, you can go right or left. And alhamdulillah, that risk calculator is done with the collaboration of the Mufti of Egypt, professors from Al-Azhar University. We all know Al-Azhar University is a very modest religious entity, institution, that their opinion is obviously accepted in many countries. That's when we develop international guidelines. But obviously for each group, for each country, if they feel that the information is not suitable for them, they need to modify it locally in collaborations with their local religious authorities.
Sure. Thank you very much, Mohammed, for this insight. And I want to now address this question to Sheikh Dr. Al-Qubaisi. Many times we advise our patient not to fast, but some of them, they insist to fast against medical advice. So what is your message to this group of patients?
Bismillah, alhamdulillah, wa salatu wa salam ala rasulillah. Thank you very much. This is quite an interesting question and very important one. And as the professor have just mentioned, the cases and situations of patients differ from one to another. Now, there is one critical point in your question. As you mentioned that he is fasting against medical advice, which means supposedly his history has been studied and his case and his own specific conditions, and based upon that, the doctor advised him not to fast. So I will assume that fasting in such a case is dangerous for him. If it is considered dangerous for him, either by the advice of a trustworthy doctor or by his own knowing about himself and his own experiences, and he knows for sure or with a high probability that fasting could endanger him, then this is forbidden. It becomes haram to fast in this way, because Allah Almighty said, do not cast yourselves with your own hands into destruction. Do not intentionally cause harm or death even to yourself. This is forbidden things. So if it poses high risk or danger, then it becomes forbidden to fast. And there is no fasting upon him. He will get the full reward of fasting, inshallah. However, he does not fast. And instead, if this is chronic and there is no hope of cure in the future, he simply break the fast and feed a poor person for each day. On the other hand, if it is moderate and with a slight possibility of harm, then it could be depends on the case by itself. It could be haram as well, forbidden, or disliked only, not directly forbidden. So it depends on the case of the patient. If the doctor advised him just simply, as the doctor said, generally, he gave him general case without studying him carefully and simply told him, don't fast because you are type 1, for example, diabetic, while he knows of himself that he can fast normally, he is young, athletic, and taking good care or controlling his situation, so he knows that he can. There is no sin upon him in fasting in this way. So it actually depends on the his own condition and the possibility or probability of endangering himself. Allah Almighty knows best.
Thank you very much for your input, Dr. Qubaisi. And there's one question from the audience. I know that Dr. Mohammed Hassanin had already maybe responded to this, but I just want to read it. Is dehydration not a big risk for those with diabetes who are fasting, more than the risk of hyperglycemia or hypoglycemia? What do you think, Mohammed?
Well, they're all very important. Dehydration could be very important. Hypoglycemia. I mean, the problem with hypoglycemia, if are not addressed immediately, can cause coma and brain damage. While dehydration effect, the body can sustain dehydration for many longer hours. But with hypoglycemia, if my body is unable to react and get me out of hypoglycemia, it could end up with a serious condition. So I don't really want to say which one is more important or whatever, but certainly all are very important. And the beauty in that Allah subhanahu wa ta'ala is Rahman Rahim. And he gave us the license to replace this day. So a specific day, I feel terribly dehydrated because of a special issue or hypo or hyper, break my fast and compensate for that day rather than expose my health to dangers, and then that would not be a good point from my religious point of view. I mean, I'm not, of course, we have Sheikh Qubaisi here, but some people push themselves to harm thinking that I'm a better Muslim this way. My personal understanding that this is wrong. If I'm going to endanger myself with a bad hypo or dehydration or hypoglycemia, the essence of the religion is that my health is amana, is a gift from God, and I need to protect it. That's my understanding.
Sure. I go back again to Dr. Qubaisi. وَإِن تَصُومُوا خَيْرٌ لَكُمْ. The verses of Quran that says the fast is better for you, some understand that it is applied to those who are advised not to fast. Can you explain to us the exact meaning of these verses and how it applies to people with diabetes at risk of fasting?
Thank you. Allah Almighty says in the Holy Quran, وَأَن تَصُومُوا خَيْرٌ لَكُمْ إِن كُنتُمْ تَعْلَمُونَ. So, and to fast is better for you if you know. The revelation of this verse came in the very beginning of the obligation of fast when there was a choice. So at that time, in the beginning, because it was the whole religion of Islam came at intervals or in steps to educate people and guide them slowly and gradually. So the person who was resident and healthy and able to fast, at that time, he had an option, either fast or break the fast, but feed a poor person for each day. So it is his desire and his own choice. And however, if he will feed more than one person and give more food to poor people for each day, this is better. And to fast is better for him if he knows. So that is where the ayah comes, when there was an option for someone who was resident and able to fast. The poor person in both ayah, the first and the second ayah, in both of them, the poor person, the patient person, the sick person, someone with a case or a traveler, they have a different ruling, and that ruling is that they don't fast while they are sick or when they are unable, because there is hardship upon them. Rather, they break the fast and make up for it later on, as Allah Almighty mentioned in the Holy Quran. So, وَأَن تَصُومُوا خَيْرٌ لَكُمْ, and to fast is better for you, does not concern the patient or the sick person or someone upon whom fasting is difficult. Allah Almighty knows best.
Thank you very much. And one more question, Dr. Qubaisi, if you allow me. In the Holy Quran, it was mentioned more than once, مَنْ كَانَ مَرِيضًا أَوْ عَلَى سَفَرٍ, whoever is ill or traveling. I am also aware that the hadith of Prophet Muhammad, peace upon him, that is advised to apply the facilities of exemption, اللي هي الرخصة. So can you elaborate on this point, please? What is the best for a Muslim diabetic who is at a high risk and push herself or himself to fast? Is this best to do, or to use the license of not fasting, which is the rukhsa?
Yeah, alhamdulillah, as you mentioned, there is a relaxation in the religion, and there are permissions in certain cases. One of them is the permission for someone who is patient or traveling not to fast. And this is a permission and relaxation from Allah Almighty. Does that mean that he is a less of a Muslim, or he has less taqwa or piety, etc.? No, this is a relaxation from Allah Almighty. When someone takes it, Allah Almighty loves that. And Allah Almighty is giving you a permission or relaxation. Allah Almighty loves that you follow that as well. And that is why we have one of the Sahaba radiallahu anh, Hamza bin Amr al-Aslami, and he said to the Messenger sallallahu alaihi wasallam, "O Messenger of Allah, I travel a lot. So can I fast while I'm traveling?" The Messenger ﷺ said to him, if you wish to fast, you can fast. And if you wish to break the fast, you can break the fast. And in another narration, he said, O Messenger of Allah Almighty, I have strength to fast while traveling. Is there any blame upon me? And the Messenger ﷺ said, this is a permission or relaxation from Allah Almighty. So if anyone who follows that or takes that, this is good. And anyone who loves to fast, there is no blame upon him. So to put that into perspective about our case, the patient knows himself better. He knows his situation better, and he consults his trustworthy physician or doctor, and then he decides what suits him, because he knows his situation and circumstances better than anybody else. The only exception is that in case he knows that fasting is dangerous for him, is going to endanger his health or himself, or cause undue hardship beyond the norm, then he should not fast. Rather, he breaks the fast and he make up for it later, because Allah Almighty says in the same ayat, Allah Almighty says, Allah Almighty desires for you ease, and he does not desire for you hardship. So the religious guidance and the religious obligations in Islam are not there to cause hardship or difficulty upon people, because Allah Almighty does not love that. Allah Almighty loves that a person takes these permission if he requires them, or when his situation calls for that. Also, this is different from a person who is permanently sick without any possibility of a cure in the future, and either his medication or his situation does not permit him to fast at all. His ruling is entirely different, because for him there is no fasting at all, and he does not make up for these days at all as well. Rather, he simply feed a poor person for each day, which is a small amount of food, enough for a poor person, and that's it. Allah Almighty knows best.
Thank you, Sheikh. I have a couple of questions also from the chat box here from Professor Shabin Masood from Pakistan. This is addressed to the three panelists. What is the Islamic ruling for fasting in uncomplicated pregnancy? A lady who's pregnant, but her pregnancy is uncomplicated, whether she have to fast or not. So I start with Dr. Hassanin, and then we can hear from Dr. Qubaisi as well, and Dr. Amaisa.
This is a very important point, and when we were writing the guidelines for that chapter, myself and other colleagues, and when we were writing the results of some of the studies in pregnancy, for ladies, as Dr. Masood says, they were not known to have diabetes. They only had diabetes during pregnancy, which is a much milder case. And we started digging the research. We found from the research, it's documented that healthy pregnant ladies get episodes of low blood glucose levels. And we started to say, subhanallah, that's perhaps why Allah subhanahu wa ta'ala, with his wisdom, he gave the license for the pregnant woman, knowing that if she does not eat, she will end up with low blood glucose levels. So that's healthy person. Now, if we go to a person with diabetes, the recommendations is very tight. To prevent problems for the baby and problems for the mother, we request, based on science and research, that the blood glucose level is a very narrow window. Between 70 and 1 hour and 2 hours after food is 125, which is definitely very low. So if I were to ask a pregnant woman who's been fasting for 15, 16 hours, not only to fast and not to have low blood glucose while fasting hours, but when she eats very small amounts and not to have her blood glucose level be above 125 or 120 after 2 hours. That is very, very difficult. So the question is, why should the woman put herself into that risk for herself and for her baby when she will not be pregnant forever? She can compensate later. There is another important point which many colleagues are saying. We do not know, because some take it as I'm able to fast, al-qudra. So they think because I can fast, but they don't know the impact on the baby long term. And many are asking the question, what happens to these babies after they are born 3, 4, 5, 10 years on the line if when they were pregnant, when they were into their mother's womb, they were exposed to high blood sugar levels because of not eating or drinking or lots of hypos. So there is lots of uncertainties. And that's why every single guideline from a medical point of view says you have a very clear license of not to fast. And we are not certain medically either that you can safely fast. So that's why from a medical point of view, we say very clear, pregnant and breastfeeding women already have an automatic license, and they need to listen to this and not put themselves into jeopardy and their baby, not only themselves, but their babies as well.
So, Dr. Qubaisi, you know, to continue on this, it is the question from the Professor Shabin, you know, following this, is the Islamic ruling different of early versus late uncomplicated pregnancy? As there is enormous transmission of mineral nutrient from mother to the fetus in the late pregnancy, you know what she mean that, you know, is there is any difference from the early pregnancy or late pregnancy? Because, you know, there's from a medical point of view, we know that there is enormous transmission of minerals and nutrient from the mother to the fetus in her later pregnancy. So probably maybe she may not fast in the beginning, but later she can carry on the fast, or the other way around. If you can just elaborate on that.
Yes, there are two points. The first one is that there is a narration. There is a narration which mentions that there is a relaxation for a pregnant woman and a lactating woman not to fast, and they can make up for this the fasting later on. However, the most scholars say that the actual ruling depends on the situation or the case of a person by herself. So if she is healthy, she does not have any complication, any lack of nutrition, for example, etc. And especially in the beginning of pregnancy, as the doctors mentioned, so she should fast, and there is no blame upon her if she needed to break the fast, even during the day at any time, if she feels very thirsty or hungry or tired, etc. But she started the fasting. For someone with different cases or difficulty or probability, even without no need for certainty. Dr. Muhammad said there are no certainty. Actually, for this ruling, you do not need a certainty all the time, but high probability is enough. So it depends on the case of the person. If there is a high probability of difficulty for herself or for her fetus or baby, then she can break the fast without any blame at all. She can make up for the missed days later on. For the lactating woman, the ruling is the same. So this is for normal pregnant woman. For diabetic woman, we go back to the same ruling, because I think, and the specialist can elaborate on that, probably the complication of diabetes with pregnancy might increase. And also some pregnant women might have diabetes while pregnant, and not in normal cases. So at that time, it's going to be difficult for them to fast, and they follow the ruling as we mentioned before. So the actual decision or the final decision is on the case of the person herself and the advice or the medical advice. And if she would like to take the relaxation at any time for fear even for herself or for her baby, this is enough of an excuse, and she can follow that relaxation without any problem or blame. Allah Almighty knows best.
Can I ask a question, Dr. Fathiya?
Yes.
Sheikh Qubaisi, you put a lot of emphasis on the individual himself knowing himself. But sometimes we as individuals, when we know that obviously as doctors, that the consequences are not obvious for us immediately.
True.
They are could happen a bit later, and then it'd be too late. So the circumstances frequently we see, whether in pregnant women or another person with diabetes, they take it as, I feel okay, but because they don't feel or know about the possible consequences later. So for example, for a pregnant woman, if she were to end up with high blood glucose levels or low blood glucose levels, these could have consequences on herself later during delivery or on the baby. She doesn't feel them now, but they might happen later. So how much do you weigh between how I feel as an individual versus the expert advice when the doctor or the healthcare professional have already given the person a scientific advice? Are they equal in weight, or should I, as a patient, then listen to my expert and listen to the recommendation and the guidelines?
Very good. And I think there was a glimpse of answering this in the beginning, and this is a very important point, which we say the medical advice of a trustworthy doctor who studied his case or her case, and based on that gave him the advice. We have already mentioned that, and this has a high ruling or priority, and that is what should be followed. And the second point is when we mentioned that if the doctor gave a general advice without checking the person himself, that is when he resorts to what he knows about himself or what she knows about herself, not what she feels, what she knows. For example, if she was following her cases or doing a checkup from time to time, and she noticed that there is no difference or drop in any of the results while fasting or not fasting and so on. If he knows or she knows about herself, not feeling. So your point is valid. It is not about how the person feels simply, but what he actually knows. If he does not have the correct medical advice, if he has the correct medical advice backed by the study of the case, then that is the point that he or she should follow. Allah Almighty knows best. So hopefully this clears the idea.
Thank you very much. I just move on with the question to Dr. Maisa. Now, many people, once they break their iftar at the Maghrib Adhan, they start to take several pieces of dates and they drink, a sugary drink like Vimto, Qamardin, which is common in our area. And for a person with diabetes, this could be excessive. So how to achieve a balance between, what they take, and how many pieces of tamar would be allowed, and what kind of drink that you recommend that they break their fast with?
Yeah, if you come to dates, if you consume 3 dates at iftar time, your blood glucose will spike. But if only a single date is consumed, it won't cause you this spike. If you're eating a high glycemic index, for example, similar to some people with hypoglycemia, you advise them to treat their hypoglycemia with 3 tablets of dextrose or 100 ml of juice. This will spike the blood sugar, but you don't want this to happen because they're gonna eat afterward. So if you're eating high glycemic index food, you can limit that effect on your blood glucose by keeping the portion size small. Of course, there are other hacks or tricks to use. Don't eat the tamar as it is. You could add fat and protein to the meal, to the tamar itself. So you can soak the tamar in perhaps unsweetened soy milk or full cream yogurt or milk. This will slow down the digestion and the digestion of carbohydrates. Another hack is to add tablespoon of chia seeds, which is very low glycemic index and will help in keeping the blood sugar low. Of course, for the same applies to high sugary drinks like Amareddin. Try to have a diluted one. Think wisely. Make it diluted, small quantity like 100 ml or less. Add a teaspoon or a tablespoon of chia seeds and maybe 2 tablespoons of milk or yogurt. It won't alter the taste, but maybe some people add a half avocado as well while mixing the Amareddin, so to give it some more fat to be less absorbable. Of course, you can try this from time to time, but try to keep yourself safe by sticking to water, the easiest and best. Fruit smoothies made with berries, fruit, with added baby spinach leaves, for example, avocado, chia seeds, ground flax seed is a good choice as well. Or otherwise, in hot weather, try a simple chilled soup for summer by mixing tomato juice with plain yogurt, for example, and seasoning. seasoning well with 1 or 2 ice cubes.
Sure. Thank you very much, Dr. Maisa. It all, sound very tasty.
Yes, it is.
And I'm sure, we will all try this. But I want to extend this question to Dr. Qubaisi. Now, some take tamar as a sunnah. And as Dr. Maisa had mentioned, some alternative for that so that their sugar does not go high. So how to fulfill the sunnah without causing a high blood sugar?
And this is a very important and practical question, because you do not want to practice the sunnah and cause harm to yourself. This, guys, again, is the main concept in Islam and the level of priorities. So preventing harm has a priority over practicing a single sunnah by itself. For the sunnah for breaking the fast on date or tamar or rotab, rather, the actual ruling depends on 3 points. The first one, the case of the person himself and his level of diabetes, etc., the type of or management of his nutrition or restriction that he is following, or dieting that is recommended by the doctor, whether this allows or permit including tamar or not, for example. And if he's checking also the result of his checking before iftar or at iftar time. Then after that, and as the doctor mentioned before, there are different glycemic index for different types of tamar. So you could opt and for something that is low in this index, as well as try to add with it anything else as the doctor advised. Third point, which is very important, some people think that the sunnah is to eat 3 dates or 3 pieces of tamar. This is not actually the case, and if you eat 1, you have already fulfilled the sunnah, or even half a 1, you have fulfilled the sunnah to break the fast with this type of food. Final point, the advice of the Messenger ﷺ or the sunnah is not date per se as it is as tamar, but rotab, which is the fresh one, which is much less sugary and than the dry date. So the sunnah is with the fresh one or the rotab, so he can opt in for that as well, which is much safer for him. In general, if it is safe for him and the doctor allows him to take that, he can start with this sunnah. If it is not, then there is no blame upon him. He will get the reward for his intention, and there is no need to endanger himself. Allah Almighty knows best.
Thank you very much for both of your input. Dr. Maisa, I still would like to ask you one more question. Ramadan meal is frequently much larger than the usual and full of carbohydrate and fat, rich food, which can lead to hyperglycemia. So how can a person with diabetes avoid these problems? And what food or meal or drinks that need to be careful with?
Okay, let's agree that our aim is to achieve optimum glycemic control. In addition, for type 2 example, for type 2 diabetes with obesity, they will need to lose some excess kilograms. Ideally, the patient needs to visit his clinical nutritionist, physician or dietitian by enough time before Ramadan to put the suitable individualized general plan. In the place where I work too, in one clinic, I start a CBT program that will help him succeed to get rid of some of the unwanted behaviors and replace them, of course, with good ones before Ramadan starts. As simple. Of course, in this visit, a patient will have enough time to learn about proper healthy cooking that helps his blood glucose to be kept steady and not to spike. For the calorie need, I basically rely to a body composition, the in-body machine, that gives a clear picture about his percentage of muscles, contents, fat, and water, as well as the daily needed calories, and we start from there. So half of the daily calories should be kept to iftar, while 30 to about 40% for suhoor, and only 10%, maximum 20% for snacking, if there is any. We draw a weekly plan for his favorite dishes that is a little modified to prevent spiking. During this visit, of course, He learns how to replace sugary desserts with the healthy ones. He learns new recipes that is low in carbs as well. The patient will have the chance to learn to select carbohydrates which are high in fibers, like the brown rice, instead of white rice and the Egyptian ones and the sticky Japanese one. It's better to use the basmati rice because it takes longer time to be digested. Of course, rely to the brown bread as well and toast. Stuffing vegetables, instead of stuffing them, the mahshi we call it, instead of stuffing them with rice, you could try quinoa and it tastes good. Of course, desserts baked with almond flour and psyllium husk rather than regular flour will help in that matter. So when it comes to Ramadan time, he would ultimately choose very wisely. Of course, I would advise my patient to eat less red and processed meats and substituted with white ones like fish and chicken. Food like hummus, baba ganoush, or lentil soup, the legumes, always have low glycemic index when it is digested. When the food is processed, that increases the glycemic index. When the food is overcooked, that also increases its glycemic index. So for vegetables, I prefer steaming rather than boiling. Stay away, of course, from fizzy drinks, white bread. The pasta is low glycemic index when it is eaten in small quantity. Yes, and stay away from jam and spread, high sugars, and again the Egyptian rice and the Japanese sticky one.
Thank you, Dr. Maysa. We have some questions in the chat box, but I'm sure that we're going to cover them as we go on. And I promise our audience that we will cover those questions that's in the chat box. Dr. Hassanin, from physician point of view, what could be done to avoid this problem of frequently high blood glucose level in Ramadan?
Yeah, thank you very much, Dr. Fathia. High blood glucose level in Ramadan is very frequent. And the recent surveys that we did showed that more people are having high blood glucose more than low blood glucose. Obviously, Ramadan meals are very rich, and some people carry on eating from iftar until suhoor. So, of course, the first message is to listen to the healthy advice from the clinical nutritionists, from the dietitians, or from the clinicians in general. Secondly, we as clinicians need to perhaps stop the practice of excessive reduction of the medication for Ramadan time, thinking that the patient will most of them will get low blood glucose levels. We need to look into the patient profile and adjust the treatment according to the profile. So those who have perhaps extremely well controlled, yes, it justifies to cut the medication. But those who are not well controlled or with high medication, they certainly do not need to adjust the medication by reducing. If they need, perhaps they will need increase in the medication during the eating hours. Furthermore, obviously there are different types of therapy that best suit the time of Ramadan. So with understanding my patient and with giving them the right education and the right advice and the right review, that could all help. And the fact of the matter is Ramadan does not come suddenly. We all know when is Ramadan well in advance. So we as healthcare professionals, as well as the patients, and certainly everybody concerned, religious authorities, media authorities, we need to advise our people well in advance to get ready for Ramadan so that Ramadan becomes a safer month for the person with diabetes. So choosing the right medication, adjusting the medication up or down according to the individual case, and above all, listening to the clinicians, and also listen to the hadith and the hikmah from, Dr. Kubaisi, you're with us. There is the saying of a third for your food, a third for your drink, and a third for your breathing. I think we fill 6/3 with food and 10/3 with fluids, and we do not breathe for 2 hours. that need to be also addressed by our religious authorities, who the patients listen to them much more than they listen to the medics.
So this is exactly my follow-up question to Dr. Qubaisi. From religious point of view, what can you advise to avoid excessive eating, which could be harmful for a person with or even without diabetes?
Yeah, this is a very important point, and it is based on something that is fundamental in Islam, which is the people of speciality. Allah Almighty says to ask people of remembering when we do not know. And usually for matters, for example, medical matters, the physician and medical personnel are the authority and reference, even for the religious ruling by the scholar. So when the scholar gives general guidelines and can give, as the doctor mentioned, such guidelines based on the opinion and the knowledge that the specialists give. And so it's a matter of collaboration. The advice to them is, as the doctor mentioned, we have general guidelines about food intake in Islam, and this is all the time, which is to be moderate. Allah Almighty says, and eat and drink, but do not be excessive. So even drinking, and sometimes we hear some advice from some doctors to drink that much and drink that much and a lot of drink, etc. From the Islamic point of view, moderation is everything, even in drinking, even water or otherwise. So it depends on what you actually need and what benefits you, but you need to be moderate all the time. And the moderation continues throughout, even in suhoor and especially also in iftar. And during iftar time, the sunnah is to start with something that is very light. So a piece of date, some sip of milk or water or yogurt, and that's it. And you go for the prayer, and then you come back, and then you can have the meal, which is about 20-25 minutes or so. And then you can have the iftar meal if you'd like. This with a gradual intake will suppress the hunger and will make the person moderate while eating. And when eating, if someone wishes to eat a lot, that is where 1/3 for solid food, 1/3 for liquid, and keep 1/3 empty for breathing. That is the guidance of the Messenger ﷺ for someone who loves to eat a lot. This is not for normal cases. For normal cases, moderation is slightly less than that. Also, we need to keep in our mind that our bodies and our health is a trust from Allah Almighty. We don't own it. You do not own your body or any of its capacities or limbs or organs, and it is entrusted to you to take good care of it. And the person will be asked, as the Messenger ﷺ mentioned, he will be asked about his body. How did he wear it out or away? What did he use with it? And the Messenger ﷺ also said, your Lord has right upon you, your family has right upon you, your guest has right upon you, your eyes has right upon you, that is sleeping or relaxation, and your body has right upon you. So give each one their due rights or his due right. So we have to balance the all aspect of life, including the right of the body and the right of Allah Almighty. So when a person feels difficulty or fears dehydration or complication or any other cases, he should not fast, and he can break the fast, and there is no blame upon him or any sin upon him. As we have mentioned, this can be known by the advice of the specialist and trustworthy doctor who advised him so based on his case, or by the knowledge that he knows about himself from previous fast or practices or checking. Allah Almighty knows best.
Thank you very much, Dr. Qubaisi. But can I just, take your last sentence? Because we as a healthcare provider, as a physician who provide those advice, some of our colleagues are afraid that giving, this advice about fast or not fast for someone who are borderline medical illness may be, not right or haram, or we will be blamed for this, or we have them for this. So what is you think from the Islamic ruling in this situation?
This is actually a good feeling, I will suggest, because this means that the person actually takes care about and weighs his decisions carefully and would like to make sure that his decisions are correct. And this is something to be commendable. And for the person, you should not be afraid. if you have done your best and you have reached this decision, don't be afraid to say there is no blame upon you. The Messenger sallallahu alaihi wasallam mentioned to us that when a person is taking a decision, and if he has done his duties, if he has struggled to reach a correct opinion, even if he makes a mistake, he will still get one reward. If he may get it correct, he will get double the reward. So there is no problem and no need to be afraid, but you need to actually do your part. Study the case carefully and correctly. For borderline, the matter is probably slightly different. If there is high probability, this is enough. You don't need even to reach borderline. If there is enough probability of complication, this is enough of an excuse, valid excuse from the religious point of view, not to fast. Allah Almighty knows best.
Thank you very much. This is very reassuring to all my colleagues, and to the colleague had also sent this question in the chat box. So Dr. Maysa, now the question is you. The gap between iftar and sahur in many countries could extend from 7 to 8 hours. So we see some people snacking constantly, all the day since they break their iftar till the time they go to sleep. And how many snacks can a person with diabetes take? And give us example of a healthy snacks in Ramadan, please.
Yeah, sure. The long gap between iftar and suhoor is the chance to have snacks. Unfortunately, for countries like Finland, Russia, Greenland, and Switzerland, and Scotland, they will have a very long fasting hours this Ramadan, around 20 hours. They won't have enough time for snacking, for example. So please try to enrich your suhoor to avoid the hypoglycemia that comes just before iftar. On the other hand, the lucky Muslims living in New Zealand and Malaysia, Australia, South Africa, and Argentina, as well as Chile, fasting time will be around 11 hours. So they will have plenty of time to have snacks. So please try to choose wisely. Low glycemic fruits like berries and cherries, that is a good one. Maybe a handful of nuts, that will work perfectly. And of course, all the non-starchy vegetables.
That's nice. As I told you, you're
Halabiyya and ruz b'laban and Ali and kunafa are not healthy snacks.
Well, you can modify some of them. That's what I was talking about. Look for recipes, new recipes, Google it, check with your dietitians or consultant physician of nutrition to come out with some recipes to eat whatever you want, like atay, if you can use oat flour or almond flour rather than the brown flour or the white flour or whole wheat flour that we usually use. You can stuff it with nuts. The syrup, instead of using the syrup, you could go to honey or any low sugar syrups.
Okay, thank you, Maysa. And as I told you, you are making us hungry, mentioning all those healthy, diet as well. Muhammad, hypoglycemia is a concern of many in Ramadan. What does a person with diabetes do to avoid or reduce the risk of hypoglycemia in Ramadan? And we have many questions also in the chat box related to the new generation of oral as well as injectable therapy like the SGLT2 and the dehydration, and then also the GLP-1 with their side effect and complication, and when is the time to initiate those drugs. So I just put all together because these are, I think it's all related. So if you can address the hypoglycemia and then you address the new generation.
I actually will address both together. We have what we call Ramadan-friendly medication and less Ramadan-friendly medication. Alhamdulillah that in the recent last 5 to 10 years, there's been plenty of options for us to use in diabetes. And indeed, they are very helpful even during Ramadan. So the two classes of drugs that are known to cause low blood glucose levels, which is the hypoglycemia, is insulin and the other class of drug named sulfonylurea. The classes of which people know the names, dawanil glibenclamide, amaryl glimepiride, diamicron glycoside. Some of them have been done in studies, and with the right dose and with the right circumstances, the dose could be continued safely, and in others, the dose need to be reduced. So check with your doctor about the medication so that the timing, the choice of the medication, and the dose of the medication could be adjusted for a safer Ramadan. The vast majority of the drugs could be carried continuously. So we don't really need to all of a sudden stop this drug for a Muslim person during Ramadan. We need to modify the treatment in advance. So the advice for the doctor and for the patient, be proactive and remember what happened last Ramadan. And maybe for all of us, when we prescribe a new drug, especially for those who work in the private sector, they are not sure when they will see this patient again. So think always Ramadan any time of the year with a simple advice of, when it comes to Ramadan, this is what you need to do. So in general terms, these two classes of drugs, we need to possibly modify the dose in some, modify the timing, or the choice of the type, because between them, there are some that are more helpful than others. Coming to the new classes, the new injections, the class GLP-1s, they are extremely helpful, no issues during Ramadan. But if you're going to initiate them, don't initiate them now, because we are 3 weeks from Ramadan. They cause a bit of gastrointestinal side effects, which could be bad during Ramadan. So if you're desperate to start them, and then perhaps if I get the trouble as a patient, I can postpone my fasting if it's deemed essential for my health. If it's not deemed essential for my health, then start them later. If I'm already on them, no need to adjust the dose, no need to adjust the timing, carry on with the same. The other class, which is very important, the SGLT2 inhibitors. This is the class of drug that causes extra fluid to be excreted from the more urine, to make it simple. So there is the potential risk for feeling dehydrated. Again, we say do not start it pretty close to Ramadan. And if I'm already on it, plenty of studies has happened, no need to change the dose, just make sure to drink plenty of fluid during the non-fasting hours. Both are very important classes of drugs. We don't want our patients to miss on them. We don't want the Muslim patient to be disadvantaged, because many of these classes can protect the kidney and the heart and help with the sugar control in general.
And what about the insulin? If the person is insulin, we mentioned the GLPs, we mentioned the SGLT2. How about the insulin if the patient's taking injectable or?
Yes, in general, if the insulin is once daily, we say take it at iftar time. Obviously, there are different types of insulin. So an insulin that will carry on its effect during the fasting hours need to be reduced. So if someone on twice daily injections, the suhoor injection need to be halved. In someone on once daily injection, we say reduce by 15 to 30%. But again, as I mentioned for the oral therapy, some people are very poorly controlled. So simple fasting with the existing dose could be a perfect choice. But for those who are well controlled, we need to reduce the dose. And there is no substitute of listening to the advice of your healthcare professionals with regards to these points, because we cannot in one webinar cover the conditions of every single person. There's too many types of insulin, and there's too many indications and timing for them. So of course, the wise doctor will be able to think of the insulin that effect will carry on during the fasting hours. That type of insulin need to be reduced specifically for those with average control or good control. For those with high control, they are obviously advised that they are at risk, but if they insist on fasting, then the dose perhaps does not need changing. Let me just quantify all of these points by one important point. We need to empower our patients with frequent checks and with a simple algorithm of what to do. So whatever advice I give to my patient, if I'm wrong, or if the figures are too high or too low, with the empowerment of how to adjust, they will get it right within days. So it's not that this is a rigid advice. This is a dynamic advice will change during the month of Ramadan. And if they apply this, it will be much, much safer, specifically for those on the drugs such as insulin and sulfonylurea.
You know why I ask you about this specifically, the insulin, because there's one question in the chat box who's suggesting maybe use a complex type of carb need to, sugar lock in fiber and fat and protein, and there's no need to reduce the dose of insulin. And he's asking if this is correct or not correct. So
yes, this is an important question, and I did respond to the person answering straight away, and I repeat again to everyone, is that the complex carb, as Dr. Maisa mentioned, is very important for everybody. For the person taking insulin, as we just mentioned, the type of insulin, the timing of insulin, and the dose of insulin need to be reviewed by the expert for this to get it right. In general terms, if the insulin is going to be exerting its effect during the fasting hours, then for most patients, the dose need to be reduced.
Thank you very much, Mohammed. And I extend this question to Dr. Maisa. If some people prefer to continue sleeping rather than waking up for suhoor, so what is your view on this, especially of those patients who are taking insulin or sulfonylurea, which is also secretagogue for insulin? And there's a risk of hypoglycemia in this group of people. So what is your advice?
Basically, for those patients, they chose to fast. I don't think they will prefer to break their fast because of hypoglycemia. Drugs like sulfonylurea and insulin, as Dr. Muhammad mentioned, eventually will cause hypoglycemia. Of course, we try to readjust the medication prior to Ramadan, 6 to 8 weeks before Ramadan. You need to see your doctor and readjust the doses. In addition, to avoid this hypoglycemia, and breaking the fasting, you will be advised to have suhoor. So there is no negotiation. You have to have it.
No, so that means they have to wake up and they have to have their suhoor.
Of course, and yes, and pray for a fajr as well.
Right. Okay.
Yeah.
That's true. Thank you. There's another question from the audience. What about the benefit of intermittent fasting? Maybe I start with Dr. Maisa and then Dr. Hassanin and Dr. Qubaisi.
Yeah, the intermittent fasting is very similar to our fasting in Ramadan. It's very good. Up to 16 hours will be very good for your health. The sensitivity to insulin will increase for type 2 diabetes, especially people with pre-diabetes who suffer from this problem. So I advise people with too much, when they have the pre-diabetes state, to start intermittent fasting. This will help them very well in their problem.
Right. Any comment from Dr. Hassanin on this?
Yes, there is lots of similarities, but also there is major differences. With intermittent fasting, we're able to drink specifically drinks that do not include calories, such as water or black tea or black coffee. We can choose the timing. So, but from a person point of view, from a health point of view, it perhaps makes them accustomed to not snacking and eating all the time. So come Ramadan, we have our own Islamic intermittent fasting, which is the Monday and the Thursday and the 3 days of the month, the lunar days of the month. And if a person would to regularly do this and to then follow the Islamic advice of not overeating and follow the sunnah of the Prophet Muhammad sallallahu alaihi wasallam, they will definitely be in a better shape than other options. But I'm not saying that intermittent fasting is bad. I'm saying there's a lot of overlap between both. But I'm more of an advocate for the intermittent sunnah fasting, because then you can get thawab as well.
Dr. Qubaisi?
Yes, thank you all. And this is actually a good question. And we can take the intermittent fasting per se is to fast and break the fast on and off, and not for a long continuous period. So this is actually a sunnah of the Messenger sallallahu alaihi wasallam, but there is no drinking in it at all and no eating. So the only difference is probably in this. And there are great rewards in that. And there are multiple levels. The minimum is to try to fast 3 days every month. So, and then after that, you can fast slightly more, which is 2 days every week. And if you still would like to do more, you can fast 1 day on and 1 day off. And this is the maximum of the intermittent fasting for a person. There are great rewards for fasting even a single day. So probably for patient, and doctor can have already covered this. This is also good advice, because he will get the reward of it, as well as it will train him or prepare him or adjust him to the fasting of Ramadan, inshallah, if it is safe for him.
Thank you, Dr. Qubaisi. And I take you back again to the question of sahur. As I had mentioned to Dr. Amaisa, many people go to sleep and they don't want to wake up for sahur. So what is the sunnah of the Prophet Muhammad, peace upon him, regarding the sahur?
Yes, the sunnah of the Messenger sallallahu alaihi wasallam is that you need to have 2 meals minimum in the day of Ramadan, which is suhoor and iftar. Both of these are sunnah and barakah, or blessing from Allah Almighty. And the Messenger sallallahu alaihi wasallam repeated that. He said, eat suhoor, for verily suhoor is barakah, or in suhoor there is barakah or blessing. The Messenger sallallahu alaihi wasallam said, it is a blessing given to you by Allah Almighty, so don't leave it. That is for suhoor. Once the Messenger sallallahu alaihi wasallam invited one of the Sahaba, Al-Irbad bin Sari radiallahu anhu, he invited him to suhoor in Ramadan, and he said, come to the blessed food. Means the suhoor. The Messenger sallallahu alaihi wasallam said that in suhoor, or those who eat suhoor, Allah Almighty send His forgiveness and peace upon them and mercy upon them, and the angels supplicate for their forgiveness and mercy. So there are great benefits in suhoor from the religious point of view, as well as in practice, because it strengthens the person, give him more stamina or ability to fast, and so that he does not cause harm or hardship to himself. Harm is forbidden in Islam. The Messenger sallallahu alaihi wasallam said there is no harm to be done or received, and the Messenger sallallahu alaihi wasallam mentioned anyone who makes it difficult for him, means does things that are difficult, Allah Almighty will make the religion difficult for him. God forbid. So the person who does not take the relaxation, eventually he will find himself in difficulties and hardship. This is not the correct way to enjoy and practice the religion and enjoy the love and relationship with Allah Almighty. Allah Almighty knows best.
Thank you very much, Dr. Qubaisi, for all this insight. Dr. Hassanin, in the DAR guideline, it was mentioned that the last few hours of fasting show a highest insulin resistant. Is there is reason and any adjustment needed for the patient with diabetes? And does fasting increase or decrease insulin resistant?
Obviously, in the guidelines, we have 53 authors from across the globe. I'm the chief editor, but I'm not the author of or the scientist behind all the evidence. In general terms, insulin resistance can improve in Ramadan with the right type of fasting. And yourself, Dr. Fathiya, recall our discussion with some of our colleagues from Germany who wanted to study the impact of healthy Ramadan fasting, and the big lines here on healthy Ramadan fasting on the impact of the liver and the fats on the liver, and obviously the indirect effect on insulin resistance. But unhealthy fasting with excessive amount of fast food, sugary food, fatty food could end up with problems. So in general terms, we have seen in many studies in healthy as well as in people with diabetes that Ramadan fasting could be associated with a lot of improvement in many parameters, including the blood pressure, the lipids, the markers of the insulin resistance, and we have published extensively on this. But for those perhaps with the unhealthy habits, it could be problematic. So I hope the person asking the question got their answer. If not, they can review the chapter for the physiology of fasting and look into the studies that have been published. I'm sure they will get a lot of information.
Thank you. There's one question to Dr. Qubaisi, and this has been asked earlier when we started the forum, and I don't want to leave it without, addressing this to Dr. Khadija Mahmoud from UAE, asking a lady in 100 years, who's 100 years old, non-diabetic, insists on fasting. Is it compulsory for her, or can she compensate by feeding the poor? Dr. Qubaisi.
Mashallah. Yes, mashallah, may Allah Almighty bless her and grant her health and full afiyah, inshallah. The idea is very simple. Allah Almighty mentioned all people, but there is a clause, which is for whom fasting is difficult, or those who face difficulty in fasting. So age is just a number. It depends on the person herself. If, alhamdulillah, she is able to fast without hardship or difficulty. This is the most, without undue or abnormal hardship or difficulty. She can fast, and there is no problem at all, and no blame. And probably this is also beneficial for her and her health. And on the other hand, if there is hardship, undue hardship or difficulty, there is no need to go to that length. Allah Almighty has already given her the relaxation. She should not fast, and instead she feed a poor person. Allah Almighty knows best.
Thank you. Now, this question is addressed to the three panelists. As we all lived in the era of pandemic, and if patient with diabetes get infected with COVID, can he or she fast the month of Ramadan? First, my question to Dr. Hassanin, what do you think? And then I would like to hear from Dr. Qubaisi, and then from Dr. Maysa, what type of diet that you would suggest. So Dr. Hassanin.
Thank you very much, Dr. Fathia. We have published on this, the peak of COVID, along with the IDF and the WHO. There are a number of aspects here. The first aspect is the person who does not have COVID, but because of his or her diabetes, could be at risk of getting COVID. So kind of, what do I do? I'm in the COVID era. And the advice here is to be cautious and to follow all the important aspects, because we know from medical point of view that unfortunately people with diabetes have the highest rates of going to hospital and going to intensive care, and unfortunately dying with COVID. So the answer here is look after yourself, get your control as perfect as possible. That's if you don't have COVID. Now, if you have COVID, COVID is an acute infection, similar to many other acute infections. And this decision for not fasting when a person has an acute infection is there, because then this person has two things: have diabetes, and on top of it have the acute infection. Now, we know that recently some people are getting the test being positive, but they feel nothing. So it applies again to the same principles. Do everyone break their fast when they have a simple cold? No. But they break their fast when they have severe symptoms or a nasty condition or fever or symptoms. So it all depends on, COVID is a viral infection, that the rules for it would apply for many other medical conditions. If you have a medical condition, to ask your doctor, then you will have two things here: the ongoing problem, which is diabetes, and on top of it, the COVID infection that we know can end up with breathing problem or diarrhea or many. Of course, if they are bad enough to need medical attention, definitely, they must not fast. Why? Few days time you be COVID free, and then you can apply the regulations of just diabetes. So it goes again from the questions being asked about how much people want to push themselves to fast and ignore the fact that your health is amana, and there is many opportunities to replace these days of Ramadan. It's not like I have missed Hajj and it only happens once. I can compensate for that for these days. And again, I'd love to hear from Dr. Qubaisi about his advice from a religious point of view.
Yes, Doctor. Thank you very much. Actually, you have covered it pretty well. The whole idea is the complication of both cases. So how diabetes is severe or managed, and where does he rate or fall under the guidelines about fasting with diabetes. Second, the complication of COVID, whether there are symptoms or asymptomatic without symptoms, and based on that and his situation, he can decide. I need to probably highlight one point. Any type of sickness, there are some scholars, we have two different groups of scholars. Some scholars say any sickness, any type of sickness, no matter what, even if it is with the least symptoms, this is enough of an excuse to break the fast. However, most scholars say only if it causes or that sickness is a little severe, that fasting becomes a little difficult, a little more than normal. abnormal difficulty or hardship. So the case of a person depends, as we said, what level of diabetes and what level of COVID or symptoms of COVID. But in all cases, obviously, having two situations or conditions at the same time will aggravate the possibilities and increase the probability of harm. So for sure, he needs to consult and make sure that it is safe. If the medical advice is to fast, then he can fast. If the medical advice is not to fast, then he should not fast and not put himself in danger. Allah Almighty knows best.
Thank you very much. Dr. Maisa, what is your input in terms of the diet for a person with diabetes and COVID?
Yeah, of course, the advice would be eat varieties of food, nutritious food, keep hydrated. You might rely to some supplements that provide you with vitamin C, zinc, and vitamin D as well. Try to take some rest and always make the plate half vegetables, quarter protein, and quarter carbohydrates. This way you will keep the food balanced and you will have enough nutrition that your body needs.
Thank you very much for all your three inputs. Dr. Maisa, I still have one more question for you with regarding diabetes, Ramadan, and exercise, the timing of the exercise or the type of the exercise that you would advise a patient with diabetes during the holy month.
Yeah. Well, plenty of studies showed that regular physical exercise keep the blood glucose level steady for up to 48 hours. So for sure, this will benefit the patient. My advice is to exercise after iftar by a couple of hours, perhaps when you go to Taraweeh. And the best exercise of all time is walking, just simple walking. For diabetic people, it's advised to have, and pre-diabetic people as well, 30 minutes every day for 5 times a week. So it's a total of 2.5 hours, 150 minutes per week.
Sure. So is there any meal plan to exercise that you recommend for people with diabetes, or already what you already mentioned?
Yeah, I already mentioned, I love the walking. Walking is the best thing that will not cause the patient to have hypoglycemia, and it will help a lot.
Thank you very much. Dr. Mohammed Hassanin, before I move to another section of this talk, and because we have just 5 minutes to close this session, what are the timing of the blood sugar checked in Ramadan?
Yes, this is an extremely important point. Checking the blood glucose level during Ramadan is important to predict and prevent the hypo. And obviously, the critical time is between Asr and Maghrib, or midday, Dhuhr and Maghrib. But also for the high blood glucose after eating and after snacking and after feasting. So checking across the day is important. For a person who has limited resources and unable to check, of course, the most important time is between Asr and Maghrib, because this is the critical time when the risk of hypoglycemia, low blood glucose level, would be the highest. But for those who are able to check more frequent, we advise to scatter across the fasting hours as well as after the meals, so that we can learn from from the figures. On a day that I had the nice kunafa or the nice bento or the nice amraddin or the nice mahshi, and I can see my blood glucose level is going too high, it will tell me, try not to do this frequently. On other day where maybe I did something good and looked after myself, it would also empower me and encourage me to sustain the same. So the checking is part of the education for Ramadan and the safety of Ramadan.
Thank you very much. And we will go to quick, true or false. So you just answer either true or false. If you want to elaborate, make your elaboration short, because we've just got a few minutes to close this session. To Dr. Qubaisi and Dr. Hassanin, is there a big difference between the medical opinion and religious opinion with regard to Ramadan fasting for people with diabetes? Is that true or false? Or we do agree?
We false. The vast majority of the eminent scholars agree on the recommendations. Our recommendations has the stamp and the signature of the Mufti of Egypt as well.
Right. And Dr. Qubaisi?
Yes, this is a false claim because all eminent scholars all over the world, they base their fatwas or rulings on the advice and knowledge they receive from the specialist. However, the problem or the misunderstanding might comes from people when they go and ask the imam in the masjid or their friends or someone with a long beard and thinking that he will give them the fatwa. So they do not get it from the reliable sources. And that is where the problem might arise. Yes. Allah Almighty knows best.
Thank you. And Dr. Qubaisi, blood tests, whether from the finger or from the vein, that's from the arm, is it prohibited in Ramadan? True or false?
False. It's not prohibited. There is no harm and it does not affect the fasting of a person. The person can perform a blood test and give blood for testing at any time while fasting. There is no harm. Allah Almighty knows best.
Thank you. Dr. Amaisa, Ramadan is month of stopping any physical activity to avoid hypo or dehydration. Is that true or false?
False, of course, false. No, I advise physical exercise. It's really good.
Already you had touched on this. Yes.
Yeah.
Dr. Qubaisi, a patient didn't fast for several consecutive years due to medical reason, like type 1 or pregnant woman, followed by breastfeeding for 2 years. They paid, which is at'am faqir, during these years. Now they can fast perhaps due to change in technology for the patient with type 1 or the woman not pregnant and not breastfeeding. They should re-fast the missed days. Is that true or false?
This needs a little elaboration. We need to separate these two groups if possible. So for type 1 diabetes, if there was no hope of being able to fast, and he already paid the food to the poor or needy, there is no need to make up for this fasting. Even if he is able to fast now, the ruling starts now for him, or the change of that ruling due to technology or medication or his case improved, etc. For a pregnant woman, the feeding is not required. What is required is making up for the missed days, because they are like any other patient with hope for cure in the future. So they cannot fast for a year or 2 or 3, and then if they don't have any medical case and they can fast, they have to make up for these days. However, if there are other complications and they will not be able to fast forever, so that is when the feeding ruling comes in. Allah Almighty knows best.
Just check on this point, Sheikh Qubaisi, because in many countries, many ladies have multiple pregnancies. So during their fertile life, perhaps they would have many consecutive years where they were, especially, let's say, a person with diabetes, then perhaps every 4 or 5 years she would be missing 3. So the amount of days accumulated on her on top of the moment. We've heard from one of the scholars saying that if it accumulates for 2 years or more, then yasqut anha at-tawid. Then she will not be obliged to compensate for these days. Can you clarify that for us? Because we get many of our patients asking the question.
This is a very important question and very important point. Let me clarify or start by clarifying. Few scholars say that there is no makeup for her and it's enough to feed. However, the vast majority of scholars and the clear guidance in the Holy Quran about a person who is patient or sick and he is not permanently unable to fast, it is very clear, which is to make up for the missed days from other days. So that is why the vast majority of scholars say that she has to. There is absolutely no basis, to the best of my knowledge, that if it accumulates for 2 years or more, there is no fasting required anymore. This is similar to anything that accumulates. Unpaid zakah, for example, for 3-4 years, or unprayed prayers or missed prayers, and so on. This is a debt that must be paid whenever she is able to. For, of course, a pregnant and diabetes patient, maybe the case is different, because here it is difficult for her to fast or to control. And if you add to that the long days or number of days, then probably, yes, the ruling is different. But for normal pregnant women who are unable, no matter how long that might take them, the general ruling, if she is able to fast safely, she has to make up for this at any time throughout the year. Allah Almighty knows best.
So, Dr. Qubaisi, does this apply to a person who had diabetes and died before making up his fast? So what do you advise his family to do in this?
This is very important question also. You see, the person who is a patient with diabetes or any other, and he was hoping to get a cure or medication and be able to fast in the future, he should wait patiently, and there is no blame upon him, no sin whatsoever, until he is able to fast. If he died or passed away before being able to, there is no blame upon him. No fidya is required, no makeup, nothing, because he had an excuse to break that fast, and the obligation to fast again did not come, because that obligation is when he becomes well, when he is safe, which didn't come. So there is no blame upon him. There is nothing to do or pay. This is different from someone who is chronically ill and he will never be able to fast. For that patient, he should feed a poor person for every day. So if he did not feed a poor person for every day of missed Ramadan, and he had the money or the mean to do so, then this must be paid from the inheritance before distribution. This is the debt, the money of the poor that is unpaid, and it must be given to the poor and needy from his inheritance if he left any. If he did not leave any, then there is nothing to do. But if his relatives or friend would like to pay that amount on his behalf, they can do so. So the actual ruling depends on the person.
If the patient is poor and chronically ill, what do they do?
Nothing. If he cannot pay the fidya, there is nothing required from him. And if the people are willing to help him and support him, he can receive the zakah because he is poor, or any general charity as well. And if he has an excess of that zakah or charity, he can give the feeding of the poor from that money. If he does not, then there is nothing required from him. Allah Almighty knows best.
Sure. Dr. Qubaisi and Dr. Hassanin, one more practical question. If an IV glucose to stop hypoglycemia had been used, as a treatment option for someone who's fasting, can he continue fast, or he have to stop or break his fast? Any IV fluid?
Let me clarify this question, because I've heard it in my lecture tours in many places, where some doctors, when they see a patient with low blood glucose level, seriously low blood glucose level, instead of making the patient break their fast and drink something, they give them an infusion for glucose, which includes obviously fluid and glucose. I find that this is extremely dangerous practice, because it will make people think that instead of the classic medical advice, immediately eat something immediately or drink something sweet immediately if a person have low blood glucose level. And if I'm now to medicalize the hypo during Ramadan, to call an ambulance or rush to the hospital and quickly put a drip, that time gap could end up with a very serious issue. And it's against, in my mind, the essence of that certainly is not yusr. That certainly is a serious usr. Plus, from the other point, now let's forget about the intravenous. Let's imagine that science would develop for us a gel that I can rub on my skin every hour and will make me feel not thirsty and not dehydrated. Will that be, it's against the essence of Ramadan. Yes, it did not go through my gut, but at the end of the day, it's in a way it's cheating.
Okay, Dr. Qubaisi, any comment on this? Because we just
yes, the injection of glucose. Few scholars, very few contemporary scholars, say that it does not affect the fasting. The vast majority of scholars opine that it invalidates the fast. So not just a wrong medical practice, as the doctor has explained, but also wrong from the Islamic point of view, because you have literally broken his fast, even if he does not know. So you have harmed him physically and also wasted his effort. There is no need for all of that. If somebody is facing any difficulties or hardship that is abnormal or endangering, simply break the fast in any way that is safe for you. There is no problem, no blame whatsoever. Some people have like a feeling, they say, how can I break the fast? You are not doing something haram. Actually, if you insist on fasting and continuing when it is dangerous or hard abnormally, then this is wrong. So we need people to understand that, and physicians as well. There is no need to go through all of that just to make him continue the fast. If it is difficult for him causing all of that, let him break the fast normally and take whatever is required to protect his health, inshallah. Allah Almighty knows best.
I'm going to ask the last two questions because one in the chat box and one we have for Dr. Maisa. Is it good to drink large amount of fluid just before Fajr Azan and to avoid dehydration during the fasting hour? Is that true or false?
Well, false. Diabetic patients are asked to start their iftar by a glass of water. Then every hour passes, I advise them to have a glass of water, a total of 8 glasses of water to be taken every day. But before Fajr, I would prefer, of course, to have a sip or so of water just to keep my throat moist.
Sure. Thank you, Doctora. There's last question for Dr. Qubaisi, and I promise you this is the last question for this forum. A student who's living abroad for his study in a non-Muslim country and unable to fast, so how to make up for his compensation? I'm not sure, is it because the long hours of the country they're living in, or there's some other reason because not able to break his fast in the place where he studied? It's not very clear, the question.
Probably we will answer both possibilities or probabilities. The first one, if the reason is long hours and this is difficult for him beyond the norm, whether he is a patient or a normal person, if it causes abnormal difficulty or hardship, he can start the fast. If he's safe and he can fast, he start the fast, and at any moment he feel that hardship or difficulty, he breaks the fast. Try again next day and so on. For a patient, it's different. Don't start the fast from the beginning. That is the case for the long hours. The second one, if he does not think that he will not be able to make up for the fasting due to the long hours, this is probably a misunderstanding. You can make up for the missed days throughout the year. Although in some times of the year, for example, in summer, they will have long hours, but in winter, they will have very short hours days. And you can make up for the missed days of the summer in that winter. So there is no harm to follow that as well. Allah Almighty knows best.
Okay, we thank you very much, Dr. Qubaisi. Now we come to our closing. First of all, I would like to thank all the three panelists, Dr. Qubaisi, Dr. Maisa, Dr. Hassanin, for this excellent forum and giving us insight about our holy month of Ramadan and about our Holy Quran and about our Sunnah. Thank you very much, and I'm sure that there are many questions that need to be also addressed, and I agree with Dr. Hassanin. We cannot just cover it in 1.5 hours, but we promise that we're going to have more educational program for these type of forum. And I would like, of course, to ask the to thank the audience for their interactive contribution of asking a question and answers as well, and for their attendance on a weekend day, and to our also event organizer Amber for making this possible. But before I would leave you, I would just want to let you know that these recording will be available, because I can see in the chat box many of you mentioning that they missed some of it or they would love to hear it again, and this will be available on the Dar al-Safa either app or on the website as well as on the Emirates Diabetes Endocrine Society, where you can also log, so that you've got the possibility of both places where you can hear all these recording. And we have previous session that we've done in the past with Dr. Sheikh Qubaisi and with Dr. Hassanin, so it will be all available, and also with our Sheikh Majdi Ashur from Egypt as well. So with this, I just leave you, these are the link. If you just can take a screenshot from there, or you just with your camera, anyhow, we cannot see you, so you can just, picture this so that you get all the benefit from those places. And with this, I would like to wish you, a good weekend, remaining of your good weekends, and also a good week ahead. But before I leave you, we would appreciate that if you give your feedback immediately after you log in from this, you will be receiving a feedback on this event. So please, we encourage you to give all this feedback, because it's very beneficial for the organizers in order to improve those type of, forum. Many thanks. and see you again. Thank you very much.
Thank you. Thank you all. I think it was
a successful one. Yes, it was a great one indeed.
You feel the enjoyment and you feel the benefit from the large number of questions and the large number of people taking part and the number of people actually saying lots of positive comments. Alhamdulillah. Thank you very much, Sheikh Qubaisi, Dr. Maisa.
Thank you very much for this effort and all this arrangement. And thank you, Dr. Fathia, for an excellent moderation. MashaAllah, tabarakallah.
Yes,
thanks to Dr. Maisa for the inputs and the healthy options that are very important, inshallah. I strongly suggest publishing that or spreading it. There were some very eye-opening advices. Dr. Muhammad, mashallah, Hassanin, he's an excellent professional in this, and he, alhamdulillah, covers both. He's well aware about the religious guidelines as well as, of course, the professional one.